Hey everyone, on today's episode of Hear Me Out, I'm speaking with Dr. Caitlin, an audiology student. This conversation is super fascinating and I hope you enjoy it. Let's get into it. Hi, Caitlin. Thank you so much for joining me on an episode of Hear Me Out.
Hi, how are you?
I'm good, thank you, thank you. And how are you?
Doing well today. Weather's nice, so can't be too upset.
Right? I know as soon as the sun starts coming out more, it's just an amazing mood booster.
Exactly.
All right, so let's start off with your connection to the hearing loss world.
Yeah. So first of all, my name is Caitlin Hearn. I am a third year Doctorate of Audiology student here at the University of Wisconsin, Stevens Point in America, in the US. Um, and my connection with the hearing loss world started, like a lot of people's did, when I was a kid. I just started My parents started noticing I wasn't hearing things well, and it took me to the doctors. They found I had a hole in my eardrum, so I had some very minor hearing or some slight hearing loss. I had a couple surgeries to have it corrected, and now my hearing is pretty much back to normal, within a range of normal. And
That's
then,
amazing.
and then from there, in high school, I found one of those um, like career course, what would you be good at type quizzes.
Oh
My
yeah.
high school made me take it. And one of the careers that came up for me was speech language pathologist. And I'm like, okay, that's interesting. That could be interesting. And then related careers was audiology. And clicked on that, researched it, and I realized, wait a minute, I have personal experience with this. Let's try that out. And that was probably almost 10 years ago now. And I've been on path to becoming an audiologist here for almost 10 years now.
That's absolutely amazing. Those quizzes sometimes, like, perfect example. It worked out for you. That's
Right.
awesome. That's so fun. So, I mean, you did just mention how you kind of discovered it, but after you had researched it, was there anything that you're like, you wanted to do the speech pathology, right? Or you're like, no, audiology, that's it.
I kind of I did a little bit of shadowing in both. I observed some speech pathologists. I knew um, some family friends who were able to let me come in and observe. And I liked, personally, at the time, I saw speech pathology as more spectrum, like a rainbow of colors, and audiology as more black and white. And
Right.
I tend to think of myself as a very analytical type person, very more black and white. I like structure. But as I've come to learn, that is definitely not true. Audiology is also a spectrum. But I liked, I know that there's medical SLP and speech path, but I really didn't learn about that until I was pretty well into audiology, but I still would not change it for the world. I love what I'm doing, what I'm learning.
That's amazing. I want to go back to mentioning that you were born, or when you were younger, you had the hole in your eardrum. So
Mhm.
your hearing is pretty standard, like you don't need any hearing assistive devices.
No. Um, so when I was about 6 or 7, yeah, the ENTs, pediatric ENTs found I had a perforation in my left eardrum. I had lots of tubes as a kid, just constant ear infections all the time. And I think it was probably all of those ear infections over time and the constant tubes. Maybe it just didn't never healed up one day. And so just noticed a small perforation, and my ENT surgeon at the time was pretty confident, and they said, "Oh yeah, we can do this." So they just re- they patched it up. I think they did a skin graft. I'm not completely sure, but I had that surgery in 2007,
Okay.
and then another one in 2008.
Okay. Wow. That's amazing that surgery allows that type of correction. That's absolutely incredible. Um,
Absolutely.
yeah. So do you have to keep an eye on your hearing loss? Like, do you get regular tests, or is it just kind of if you've noticed something, you go in?
Not so much. We found everything was normal at the level of the nerve for me. It was more of an outer middle ear issue. And so after my surgery, I was getting more regular checkups. But then afterwards, I was probably 15 at my last appointment with that physician. and we found my hearing was normal. So we said, all right, come back if you ever notice an issue. And then I went into audiology and like, okay, well, now I could just have my friends test my hearing.
There you go. It's funny how that all works out.
Exactly.
So now that you're actually an audiology student, what has been like, what have you learned so far in the field that has surprised you the most?
I briefly touched on this, that audiology is not as black and white as people think it to be at first. First, we think, oh yeah, hearing tests. That's so much more straightforward. And it can be. And then hearing aids, but then you start adding in all of the other aspects of audiology that many people don't know about. The educational audiology, where you're working with deaf and hard of hearing students in the school system. You're working with assistive devices, cochlear implants, working with the vestibular system. Because I didn't learn until much later on that audiologists test balance disorders because of how the auditory nerve and the balance nerve share the same pathway up to the brain. So
Oh,
oftentimes, if someone has a problem with dizziness, we always check their hearing because sometimes it might be affecting one another.
that is so cool. That is very neat. Yeah, I've had heard about that connection with dizziness, but it's like interesting how you put it in that perspective that they share the same nerve. Like that's you wouldn't think that.
Yep,
It's amazing.
cochlear nerve 8. I would have been ashamed if I got that one wrong. It's
Don't
called
worry.
the it's called the vestibulocochlear nerve. Vestibular being balance, cochlear for hearing.
Well, there you go. That is very neat. And there's a lot of brain connection too. Correct me if I'm wrong. Like with hearing and
Absolutely.
have have you touched on that yet in your program or?
So my program, we have a lot that we do. I would definitely say the strongest connection we have is testing and learning how to diagnose a condition called central auditory processing disorder.
What?
And so, where someone has perfectly normal hearing, at least on an audiogram and a hearing test, but then processing wise, they don't understand spoken, they don't understand auditory information. And
That is really
it's a very tricky uh, kind of case for someone to work with because sometimes it looks very similar to ADHD. It can look very similar to autism spectrum disorders. It can be just auditory processing difficulties, but that doesn't count as an auditory processing disorder. It's very tricky. It's very interesting. And it's, I'm absolutely fascinated by it. I lean more medical audiology in my terms of interests. So interesting um, cases, pathologies. I studied neuroscience and psychology as minors in college. So being able to kind of focus on auditory neuroscience is absolutely fascinating for me.
wow. That's interesting that you bring that up because I had recently talked about that on my channel where I was like, I can hear someone, but it takes me a second to process the information as if it's like going into my hearing aid, then it takes a second to go to my brain to register. And people
Yep,
were commenting the auditory disorder that you're just mentioning. I was like, wow, maybe it's that, but maybe it's also just the hearing aid is slightly delayed. So that's very interesting that you are really fascinated in that aspect because that is a totally different part of the hearing loss like world that I wouldn't have really thought about.
absolutely. And how someone can have a completely perfect audiogram within the range of normal hearing, but still have difficulties understanding auditory information. So figuring
Yeah.
out what's going on and what's the best way we can help them.
Yeah, that's probably really difficult. And a lot of the cognitive awareness too, I've learned that hearing loss has a huge, like if you don't detect it soon enough, it can have a really big effect on your cognitive awareness, which is why I guess a lot of older people can sometimes struggle with that. Correct me if I'm wrong.
No, that's absolutely correct. There are some studies that are coming out recently that show the risk between untreated hearing loss in older adults and the increased risk for faster cognitive decline.
Yeah,
So,
I think that's so important for those that information to come out because I know a lot of people in my family who are older are stubborn to get hearing aids because of the stigma around it. And it's like, right, but if you don't
right,
treat it, it's only going to make things worse in other areas too. So,
absolutely.
wow,
And
that is,
sometimes, yeah, and sometimes even just having hearing aids on, people don't realize how much effort we put into thinking when you're trying, if you have hearing loss and you're spending all of this mental energy trying to figure out what did that person say? What did that person say? Then you lose out on the conversation around you. So having the hearing aids helps reduce that cognitive effort and that cognitive load that we're putting on ourselves.
that's such a good point. And I think that also relates to hearing fatigue, which people don't realize too.
Yes,
And sometimes if you're experiencing more hearing fatigue, maybe you should go get an adjustment or another hearing test, right? Because maybe there's
absolutely.
something missing there. That's wow. So now that you've been a student for a while, do you have any tips or tricks for others who are thinking about becoming an audiologist or entering in that kind of field in general?
Yes. So if someone is considering audiology as a field, shadow. Absolutely shadow an audiologist, whether that's in a private practice setting, at an ENT setting, at a school setting. And if you have the ability to shadow and observe, try to see if you can get in multiple different settings because educational audiologist, their work is very different compared to a cochlear implant hospital audiologist. And so it's almost two completely different career paths, but just being able to find that specialty or areas of interest before going in, as well as, and just say this for everyone going into, oh, excuse me, I just say this for anyone going into school and considering higher education, know your finances, know what goes into getting the degree. Because here, I believe the United States, we are the only country that requires a doctorate level for the audiology.
Oh, wow.
So it's
Expensive.
4 years of undergrad, 4 year bachelor's degree, and then a 4 year audiology doctorate.
Wow.
Some schools do 3 year reduced or like accelerated programs, but again, to each their own, 3 or 4 years. And it is just kind of know your finances before you come in. Know what, just do whatever you can to reduce debt
Right. Fair enough.
because
And you
for
said
everyone.
shadow. Do you mean like co-op or intern, like before even entering school, like while you're still in high school, try and find like someone willing to just take you on for shadowing, I like you said, but like more of like an
Yes.
internship kind of thing?
Not even really an internship. I mean, when I was in high school, I was able to I was able to shadow at a local children's hospital, and
Right.
they just allowed me to come in and sit in the wait or sit in the observation rooms or sit with the audiologist on their side of the booth and just sit quietly, take notes, ask questions after the appointment.
That's amazing. That is so amazing. I love when like professionals allow that to happen because like you said, like I think that's so important to experience it before you put yourself into a position of potential debt because
Absolutely.
there's so much you don't know that's in just the description of the program. So um
Yeah.
that's amazing. That's a really good tip. Very
And granted, that was pre-COVID and a couple years
true.
before COVID. Because I have been in school for 7 years now.
Quite a bit of time.
Quite a bit of time effort I
But
put
you're
into
almost
this.
near the finish line, so that's
Yes.
exciting.
I am
That's
in my
very
last
exciting.
semester here at the university, and then I complete my 4th year externship, which is essentially a residency year.
That is so exciting. And that's really interesting that you laid out like kind of the process of your program because I mean, I had no idea about that, but I think that's really fascinating and really intriguing that there is so much detail to go into it to become an audiologist because I mean, it's when I go for my exams and stuff, it's nice to know that those people are very well, educated and have
Right.
learned a lot. That's
You learn a
amazing.
lot, and someday I hope to put at least everything I've learned at one point to good use.
Well, that
Give a
is true. I
wide
hope so too.
basis. give a wide basis, so that way, in that rare chance that one patient you talked about in that one pathologies class, and you're like, I remember that from that class. I remember what to do.
That's awesome. Well, thank you so much, Caitlin, for joining me today. This has been a really interesting conversation. I had no idea about the world of audiology, especially as a student. So thank you for taking the time and sharing all of this with us.
Absolutely.
So
All right. Thanks so much.